This lesson will review what reflection is. The objectives for this lesson are to define reflection and examine exemplars of effective reflection. The term reflection is derived from the Latin term reflector, meaning to bend back. A mirror does precisely that, bends back the light, making visible what is apparent to others but a mystery to us, namely, what our faces look like. Reflection is defined as serious thought or consideration, thinking about experiences, and examination of personal thoughts and actions. Here's our first checkpoint. True or false? Reflection is serious thought about experiences to examine personal actions. The correct answer is true. Reflection is a serious thought about experiences to examine personal actions. So reflection promotes analysis of experiences. It allows us to think about and then continue doing what is successful, and it allows us to make changes based on mistakes. It also allows us to build upon connections from one thing to another, and provides a clearer picture of our own behavior. Here's another checkpoint. What does reflection promote? Is it to analyze experiences, to make future changes based on mistakes, to build connections from one thing to the next, or to obtain a clear picture of a person's own behavior, or all of the above? The correct answer is all of these. Analyzing experiences, making changes based on our mistakes, connecting from one thing to the next, and obtaining a clearer picture of our own behavior. We can learn from our experiences if we reflect. Most of what we know about the world and our place in it is derived from learning through our experiences. We learn a great deal from lectures and books, but we're merely memorizing and absorbing the facts and figures, or are we experiencing them? Do we not engage in internal dialogue with the subject matter, or just experience a book? Or are we in fact reflecting on the subject matter? Answering yes to these questions recognizes we are learning all the time. The depth of reflection determines the quality of the attitude and action level. So reflecting upon our actions is rerunning in our mind what occurred in the past. The aim is to value the strengths and develop a different, more effective way of acting in the future. Reflecting upon our action is examining our own behavior and that of others while in a situation. Observing in situations that offer learning opportunities. And attending to what you see and feel in a current situation, focusing on responses and making connections to previous experiences. And being in the experience at the same time adopting a witness stance as if you were outside it. Here are some examples of questions to stimulate reflection. What is the most important thing to you right now? What resources are available? How can I best use these resources? What do I really want? How do I feel about it? What am I committed to doing? And what am I not committed to doing? Reflection is important to focus, to consider ways to interact and communicate with others, and to achieve goals and desires. Here's another checkpoint. Why is reflection so important? Is it to focus, to consider ways to interact and communicate with others, or to achieve goals and desires, or all of the above? The correct answer is all of the above. To focus, to consider ways to interact and communicate, and to achieve goals and desires. Participant reflection is important. During each interaction, the assessment, a home visit, or phone call, clinicians can ask the participant to reflect upon their desires and needs, finding out what would assist the participant to design their person-centered plan of care to meet those needs. Clinician reflection is also important. After home visits or phone calls, The clinician needs to reflect upon the participant's desires and needs and assist with designing the person-centered plan of care to meet those needs. During interdisciplinary coordination, the clinicians also need to reflect upon their assessments, the participant and the environment in which they live, what the participant's desires and needs are, and how the team can assist with meeting those needs. It's recommended that limiting to 3 to 5 actions at a time should occur so that the participant does not become overwhelmed. Here's a case study of a real-life MyChoice participant who received the evidence-based model of care during our pilot program. He was challenging to work with, thus the team discussed how reflection supported collaboration, communication, and interdisciplinary coordination. As a review, prior to receiving care, this participant had been in MyChoice for 8 years. He's the 51-year-old male who we previously talked about, who lived alone in a rental home, had a history of anxiety, arthritis, depression, hypertension, GERD, alcoholism, illicit drug use, and cataracts and glaucoma. He was unable to perform his ADLs and IDLs and had great difficulty with bathing, transferring, and ambulation, in addition to multiple other problems. Here's his person-centered plan of care. Improve ADLs, fall prevention, home modifications, turn the utilities back on, and medication management. Here is how reflection by the RN and social worker was used with this MyChoice participant. So upon assessment, the team identified an unsafe living environment, no heat or electricity, and the windows boarded up. But the participant desired to continue living there and also was unwilling to stop drinking or using illicit drugs. Upon reflection, the RN and social worker decided the participant was unwilling to modify certain behaviors, so no actions were taken. And with the desire to remain in the home, the participant then was willing to work with management company to obtain some home repairs and turn the utilities back on. This reflection by the RN and social worker acknowledged the participants' experiences related to the home environment and alcohol and drug use. And though they only planned to do what was going to be successful and make a plan based on prior experiences and mistakes, building connections from one thing to another within the participants' life experiences. They only planned for what the participant desired after thoughtful consideration and reflection. In summary, reflection is helpful to both clinicians and participants. It promotes analysis of experience, allowing us to think about and continue doing what is successful and to make changes based on mistakes. Reflection supports building upon connections from one thing to another by providing a clearer picture of our own behavior. Thank you.